ESG is a relatively new weight loss procedure that we're beginning to pioneer here in Mobile. The best way to describe it is by first telling you what a laparoscopic sleeve gastrectomy is, and it's creating a long, narrow tube of the stomach by taking out part of the stomach. Endoscopic sleeve gastrectomy accomplishes the same goal by creating a long, narrow tube out of the stomach, but it does it without any incisions. So it's accomplished all via endoscopy, which is a camera that's passed through your mouth into your stomach, and all of the surgical instruments are passed through the endoscope without using any incisions. During the procedure, you're all the way asleep. We pass a scope. It goes through your mouth and down into your stomach. And then we use a suturing device inside the stomach to narrow the stomach into a long, thin sleeve or tube. It does induce weight loss by restricting the amount of food you can eat. You will feel full quickly, and that's how it will cause some restriction in your diet and how much you eat. Ultimately, all weight loss procedures are dependent on changing diet and lifestyle moving forward, but they're a really effective tool in helping people do that. An ideal candidate for any bariatric procedure or weight loss procedure would be someone who has a BMI greater than 35 or a BMI greater than 30 with any associated medical comorbidities, things such as high blood pressure, diabetes, high cholesterol, obstructive sleep apnea. Those are the most common. And is looking for a more effective form of weight loss than the ones they've tried in the past. Generally speaking, anyone who meets those criteria will be a good candidate for endoscopic sleeve gastroplasty. There is definitely a role for both of those procedures in a bariatric practice, and choosing one versus the other will be based on several different factors. The potential weight loss for ESG is a little bit lower than a laparoscopic or robotic sleeve. However, the risk of complications or the risk of developing reflux after is also a little bit lower. And so whenever we meet, we can discuss the risks and benefits of both and go with a procedure that's best for you based on all those factors. Most people find the recovery is a little bit easier. It's done outpatient. There's less pain and nausea because there's no incisions. So it tends to be a little bit easier recovery. It's still a weight loss procedure. It's still a surgery even. And so there is still some risk. Before the procedure, we would make sure your heart and lungs and your overall wellness is good enough for general anesthesia. After that, there are some risks of things like bleeding or perforation, but those risks are generally very low. And most studies show that the risks of complications are lower than that of laparoscopic or robotic surgery.